All right, so trying to look at the different types of investigations you might actually want to do for in gynecology and obstetric issues. The next one we should be looking at is the fern test. So look at the fern test, which is done for ovulation, and also the fern test can be done for amniotic fluid. You understand? So for both ovulation and both amniotic fluid, we'll basically look at it and just trying to establish reasons why you might actually want to do a fern test. So first, let me get this, then we move on. So fern test, is something that we actually use, the vagina, the saliva. Okay, mostly use the saliva to actually take it out. So it's fascinating. It's a simple microscopic diagnostic method. Is used in two different contexts. You understand? It can be used for ovulation to predict it. It can also be used to dictate if amniotic fluid is leaking. Do you understand? So for predicting ovulation, for amniotic fluid leakage, that's a full package there. All right. So this version of test, that's for the one for ovulation, uses saliva or cervical mucus, when ovulation is approaching. You get? So during the fertile window, estrogen levels rise, increasing the salt content in saliva and cervical mucus. So either one of it you are using. You understand? You're just trying to dictate, the salt content. Okay. So when a sample is air dried on a glass slide and viewed under the microscope, it forms the fern-like crystals. So fern is looking like branches of a tree. All right. So these patterns, they typically appear. We said that they typically appear 1 to 3 days before ovulation, making it a predictive tool to make you know if ovulation is approaching. You understand? So key point is non-invasive, can be done at home, very comfortable. Indicates if estrogen is surging or of course in preparation for ovulation, right? Best used alongside other methods like basal body temperatures or luteinizing hormone urine test. Okay, so you see how it will look like. It looks like fern. Estrogen surging, salt content increasing. All right, that's why you have this. So for amniotic fluid now, to dictate if it is leakage. All right, so it's used during the pregnancy to dictate premature rupture of membranes. All right, just to confirm if the water has broken. So how it works: a sample of vaginal fluid is collected and air dried on a slide. Now, if the fluid is amniotic, it will form distinct ferns, just like this. The same thing. Okay, distinct ferns, just like this. So the test helps differentiate amniotic fluid from other vaginal secretions like urine or mucus. Do you understand? So key point is used in clinical settings to check if there's rupture of membranes. It's highly sensitive and very specific in laboring women. So if you pick it up and it's positive, 96% of it should be accurate, right? So it can be affected by contaminations like blood or aseptics, which may give a false result, but you just have to be careful with that. So that's it for the fern test.